So we have revision sessions today regard to these particular bones. Second half we'll do the surface anatomy. We come at 1:30, so quickly we can just learn about like surface marking. And tomorrow we have theory discussion. So how we have wrote, how we should have written. Next time when you are appearing for the exams, how you should be writing the answers, how you preparing that, how you're studying, that's more important. The way you study, that way you prepare for your examination, that's how you are going to present it. So you have to start with the preparations of your theory, practical, and as well as this interviews, the viva. So the way you are preparing, the way you are going to present in examination. So if you have a a poor preparation, you are going to have a poor examination. And if you have a good preparations, is going to come with a chances are there you are going to give a good examinations or satisfactory examinations. Now regard to the osteology of this particular hip bone and this articulated pelvis. This articulated pelvis we are bringing it here because we are going to enter this the abdomen and the pelvis. So for that reason we are going to combine it together later on when we will be starting with these abdominal bones. It will be easy for us to start through in this. So this particular bone was there in our examination as well. So we have to know how we are going to have this bone identified and site determination of the bones and the different parts of this bone, muscular attachments. So how many bones it is consisting of? 3: Ilium, Ischium, Pubis. And surprisingly, whenever we are taking the examinations, the questions I ask to someone, he doesn't know, but rest of the group knows. The moment I ask the next question to the another person, except him, everybody knows the answer. How come it's possible? I don't know. So everybody is saying, I am going to answer this, but the person is not going to say on board. Alright, so this particular bone essentially is that you will be holding that in normal anatomical position, anterior and posterior identified by this symphysis pubis anteriorly placed, and the posterior is the posterior superior iliac spine, and above or down this bone which is ilium fan shaped expanded should be above, and this one which is tuberosity should be put down because this is what we are sitting on, the ischial tuberosity on the down side. Medial and lateral, again symphysis pubis on the medial side and this acetabular foramen on the lateral side to have this hip joint placed inside to it. Now once you have this, then you have to understand how this particular bone you should be having it. Like ASIS and pubic tubercle should be on same vertical plane, and midpoint of this one which is known as this acetabulum with the symphysis ASIS should be on same vertical line. So it will be like little bit tilted and it will be having same plane you are holding it whenever you are having this anatomical position. So this is the easy thing, and then it comes with this particular different parts of the bone and relevant muscular attachments to it, like iliac fossa have the glutes attached to it. So if you have this particular glutes attached on it, like gluteus medius, minimus, maximus, all of them. So what are the importance of the gluteus maximus, minimus, medius? Comes with the Trendelenburg test. This time we have the question Trendelenburg test. No, in the prof it had. So Trendelenburg test, it will be coming which nerve you are testing, which muscle you are testing, which side nerve and muscle you are testing, basically that's what you have to know. Then you have to learn about this particular piece of bone which is known as the ischial tuberosity. Muscle attachment to it is very important because it gives attachment to all the hamstring muscles. Hamstring muscles is important in a sense, it supplies gives cover to the back side of the leg region. So back side of the thigh, this particular muscle have attachment. It has this particular 4 set of muscles, has a particular rule of these organizations or assembly, it does flexion to one joint, extension to the other joint, it has a particular nerve supply, it has a common attachment point, and again this particular muscle have got importance because this is prone to have injuries because lack of the blood supply is there in the hamstring regions. That's why it is more commonly having injuries to the hamstring injuries for the sports person. If you have sports person injured with the hamstrings, no other way other than taking rest, because poor vascularity. If the blood flow less to an organ, it heals slowly, recovers slowly, right? Because it gets nutrition, so all this required energy less in amount, so it takes longer time to recover back. That's what this particular muscle is important of. Then ischiopubic, because this particular muscle gives attachment to this particular all the medial compartment muscle. That means it is giving the attachments of the like adductor muscles. Adductor muscle have got important nerve supply. All of them supplied by obturator nerve. Obturator nerve is important in a sense. It supplies two of the joints principally, like hip joint and the knee joint. So a cry in the knee joint and it can refer to the hip joint, and a cry in the hip joint can refer to the knee joint pain. So it is having a referred pain. So this phenomenon we call them as referred pain sensation. So it is having some trouble somewhere, but it is weeping somewhere. Marbo ekhane last porbe shoshane oi type er byapar arki. So it has dual actions and in terms of presentations. Then we have to know about the hip joint. That point is important to it, and number of ligaments which is attached to it is very important. Like two of these ligament attaching this particular bone with this other ligament point makes this particular notches into foramens. Lesser sciatic notch converted into lesser sciatic foramen, greater sciatic notch converted into greater sciatic foramen by ischiotuberous or ischiospinous ligament, right? Sacrospinous, sacrotuberous ligament, sorry. So they are converting this ischial spine is important for us. More important, it will be coming here as we are entering to the pelvis. We will be coming into it. So other than this, obturator foramen, obturator internus, externus membrane and obturator nerve passes through along with the blood vessels which is running through it. Acidoculum, which is important for the hip joint or hip joint formations, and rest of the bone is kind of like easy in terms of iliac fossa, iliac part which is like there, and inguinal ligament, attachment of the inguinal ligament, medial attachment, lateral attachment of the inguinal ligament. We are going to learn detail of the inguinal ligament now as we are entering to the abdomen. We will be learning what is inguinal ligament, what are the reflections or what are the modifications of the inguinal ligament, and how this inguinal ligament is important for us doing surgery or identifying any diseases related to the clinical problem like herniations or etc. etc. Now from this region we are going to talk about this point, this particular bone, though we have a separate different class on this pelvis hip bone. So this part, this bone we call them as articulated pelvis. That means it's joined together. It has a middle bone on the back side, sacrum, and two hip bones, right side hip bone, left side hip bone. Together joined, we call them as articulated pelvis. This is pelvis bone. So this particular pelvic bone have got like cavities inside to it. We divide the cavities which is present in here into two ways. We call them as true pelvis, false pelvis. How we divide that? We call a line as a pelvic brim. Now, how this particular pelvic brim coming into it? It's a kind of like imaginary line which is circulating through this particular articulated pelvis. We call them as pelvic brim, B-R-I-M, brim. The pelvic brim also known as pelvic inlet. We call them as pelvic inlet, I-N-L-E-T, just like thoracic inlet, thoracic outlet. That's like thoracic inlet, you have this pelvic inlet. So pelvic inlet is also known as pelvic brim. Now how this particular pelvic brim can be described? It's an imaginary line. How this particular imaginary line is traced through? This particular imaginary line starts from this particular joint. What joint it is? Symphysis pelvis. What kind of joint it is? Cartilaginous joint. What are the types of cartilaginous joint? Secondary, primary. How many of have you written that? Primary and secondary. Very difficult question it was there. 3 or 4 of the like I checked the copies, 3 or 2. 2 of them written only. Primary and secondary cartilaginous joint. 2 of them. Very difficult question. Cartilaginous joint. Classify the cartilaginous joint. So what are the 2 types of cartilaginous joint? Primary, secondary. কি বলবি? একটা করে এক্সাম্পল বলবি, বলবি কেন প্রাইমারি? বেশ, খুব ভালো, একটা এক্সাম্পল বলবি। গুড, বেশ, গল্প শেষ। সেকেন্ডারি কার্টিলাজিনাস জয়েন্ট, একটা এক্সাম্পল বলবি। গুড, ঠিক আছে, তৈরি? ওকে, So listen up. বল প্রথম থেকে বল টাইপস অফ কার্টিলেজ, প্রথমে টাইপস অফ জয়েন্ট গুলো বলবি, তারপরে বলবি যে কোনটা কি, মানে কথা শুরু করার সময় যেরকম বলতে হয় যে হোয়াট আর দ্য টাইপস অফ কার্টিলিয়াস জয়েন্ট, ঠিক আছে? কি টাইপের আছে, প্রাইমারি, সেকেন্ডারি, প্রাইমারি কাকে বলে একটা এক্সাম্পল, সেকেন্ডারি কাকে বলে একটা এক্সাম্পল, ঠিক আছে? আবার স্টার্ট কর, ইংরেজিতে বলতে হবে। কি হলো, এত তাড়াতাড়ি বললে কিছু বুঝতে পারলাম না, আবার ভালো করে ভেঙে বল। Cartilaginous joints are of two types. What they are called? Primary and secondary. Okay. Define the primary cartilaginous joint. Aste. Between the primary cartilaginous joint, there is a higher presence of a hyaline cartilage. Okay. And that hyaline cartilage undergoes ossification, right? And that ossification, what you are saying? Endochondral ossification. That means the cartilage is transformed into bone, becomes a continuous structure. Example of it? Epiphyseal plate. Okay, where the epiphyseal plate is there? In the long bones, ends of long bones. Ends of long bone where this particular metaphysis and diaphysis present in between, right? Okay, that's a primary cartilaginous joint with an example. How about secondary cartilaginous joint? There will be another fibrocartilage, but that fibrocartilage is not going to have an ossification. Example of it? Example of an intervertebral disc. Could be many. One of the example is intervertebral disc, right? How difficult it was? Memorize and answer it. Go. Thank you. প্রত্যেক দিন আসবি আর পড়া বলবি দাঁড়িয়ে দাঁড়িয়ে লোকদের, তোরা এসে এখানে এসে ঘুমিয়ে আয়েস করে লাক্সারি লাইফ কাটিয়ে রিসর্টের মতো চলে যাবি, এটা আর হবে না, বুঝছিস? ইউ ডু কাম অ্যান্ড কন্ট্রিবিউট। নিজেদের জমি নিজেদেরই চাষ করতে হবে, নিজেদের ফলন নিজেদেরই ফলাতে হবে, বসে এখানে বসে চিল করে চলে গেলে হবে না। ইটস নট এ মুভি থিয়েটার। Was there? Not anymore. লেকচার ক্লাসেও তাই, তৈরি থাকবে, যখন তখন তুলবো, তুলে নিয়ে ডেকে নিয়ে আসবো, ঠিক আছে? হ্যাঁ না না, শুনতেই পেলাম না, ভয়েস চোকড। So this particular joint, symphysis pubis. Pubis symphysis is which type of cartilaginous joint? Why secondary? The cartilage never ossifies. It remains with the cartilage intact and the joint is there. So it is a secondary cartilaginous joint. Right. So we start from the symphysis pubis and roll over from here. So what we do here is symphysis pubic, then pubic crest. Then we have a bump. We call this pubic tubercle. Then we move along. Call them as pectinate line. And we move along from here, right side, and move to this particular joint. This joint we call them as sacroiliac joint. So this is sacroiliac joint of left side. Then this part of the bone we call them as ala of the sacrum. Then we go to this particular body of the sacrum. Then we move to the other side of ala of the sacrum. the ALA, ala of the sacrum. The ala word means wing, means wing, the butterfly wing, bird wing, ALA, alright. So that particular ala leads to this particular joint on the right side, again right sacroiliac joint. From there, pectinate line, iliopubic eminence, then pubic tubercle, pubic crest, and then again symphysis pubis. So it makes an imaginary circular line. This circular line we call them as pelvic brim, also known as pelvic inlet. We call them as pelvic inlet, also known as pelvic brim. So pelvic brim is an imaginary line which is present between this particular line extending from symphysis pubis of a side and then moving around all the way. It is a circular line, but again it is an imaginary line, but it can be traced on a dry bone sample. We call them as articulated pelvis. So this particular pelvic brim or this imaginary line, also known as pelvic inlet, splits this particular pelvic bone into two parts. Above we call them as false pelvis, under to it we call them as true pelvis. So it divides this pelvis into two tiers, above true pelvis. In between them we have pelvic brim, also known as pelvic inlet. So if you have pelvic inlet, we have a pelvic outlet. So this is inlet, we enter to this space, we call them as pelvic cavity, also known as true pelvis. And this pelvic cavity leads to this particular open space. If you just like make this particular pelvic bone upside down like this, so this particular space we call them as pelvic outlet. So this is inlet entering to the pelvis and exiting through the pelvis is outlet. So outlet is this one. This particular space is not completely bounded by this particular bones. Likewise this pelvis inlet. So this particular pelvis inlet is bony. Outlet is partly bony, partly ligament, which is making these things up. So this particular pelvis can be divided into two basic spaces. Outlet, inlet is holding in this particular space, splitting this particular pelvic cavity into two spaces. Pelvic cavity above we call them as greater pelvis or pelvis false, and inlet which is inside to it, which is present to this particular under to this particular pelvic brim, and this particular pelvis or true pelvis leads to this particular space which is known as pelvis outlet. Okay. So this greater this false pelvis or this above pelvis is continuous with the abdominal cavity, and this one is also continuous but can be separated from the abdominal cavity. So we call them together abdominopelvic cavity. So this abdominal cavity continuous with the pelvic cavity. We call them as abdominopelvic cavity. Now here we have a partition, muscular partition, just like we have a diaphragm in abdomen separating between the thorax and this abdomen. We have a diaphragm existing in here, muscular partition. We call them as pelvic diaphragm. We call them as pelvic diaphragms, which pelvic diaphragm is present somewhere in this false pelvis or pelvic cavity. Outside to that particular part we call them as perineum. So we are entering with the three domains in the abdomen or abdominal pelvis. Abdomen cavity, which is limited above by the diaphragm, then the abdominal cavity going down to the false pelvis or abdominal pelvic cavity. Then we get this pelvic brim. Once this pelvic brim is crossed down, we call them as true pelvis or pelvic cavity proper. Pelvic cavity is limited by a diaphragm. We call them as pelvic diaphragm. Under to the pelvic diaphragm, we have a space. We call them as perineum. P-E-R-I-N-E-U-M. Perineum, again limited by this particular pelvic outlet. Okay, so we are having three spaces: inside, out, abdominal cavity, false pelvis, pelvic brim, true pelvis, pelvic diaphragm, perineum, pelvic outlet. This is how we can be judging it. If you are coming from outside in, perineum, pelvic diaphragm, pelvic cavity or true pelvis, pelvic brim, false pelvis, abdominal cavity proper. अभी समझा, अभी भूल गए. Okay. So this particular orientations you should have before we go to the pelvic cavity, pelvic space. Now, what else we have to know about in here? That particular sacrum bone, we have this bone in piece. We will be learning that particular sacrum bone. Two spaces or two region on the sacrum bone I have mentioned. The central part of the sacrum we call them as body of the sacrum, and this part is also a part of the sacrum which we call them as lateral mass, also known as wing of the sacrum. The wing of the sacrum we call them as ALA, ala of sacrum. How many ala is there? Two. Right side, left side. Right side ala, left side ala leads to this particular region of the sacrum. We call them as lateral mass. Lateral mass of the sacrum. Lateral mass of the sacrum unites with this hip bone. Make this particular joint. Right side sacroiliac joint, left side sacroiliac joint. Right and left sacroiliac joint. Now this right and left sacroiliac joint, what kind of joint it is? It's a synovial joint. What do you mean by synovial joint? Is it cartilaginous joint? No, it is not cartilaginous joint. A synovial joint is a joint which has a synovial membrane to it, synovial cavity to it, synovial fluid to it, and this particular thing has a mobility related to it. Sacroiliac joint can be moved. Cartilaginous joint which barely moves. Primary cartilaginous joint do not move at all. So this particular sacrum, central part of the sacrum, we call them a sacrum body. The center of the sacrum body, where we see that in the upper border over here, the center of it, we call them as promontory of the sacrum. So this particular sacrum body, it has got a margin. You see that this margin which you can see here, this margin of the sacrum. If you point at the center point of it, we call them as promontory of the sacrum. Promontory of sacrum. So sacrum body, central part, promontory. This particular margin which is present, promontory is a point, it's not an area. That point is the central part of the anterior border of the sacral body. And this particular body leads to this lateral mass over here, we call them as ALA of sacrum. And then we have these foramens present in the sacrum, we call them as sacral foraminas. So there are sacral foraminas front and the back, we call them as ventral and dorsal sacral foraminas. So your work will be there to study the sacrum, how this particular sacrum is formed, like fusions of this, how many sacral bones are there, which is vertebrae, which is lumbar vertebrae are there, which are single, but the sacrum bones were single, but later on it was fused. So how this fusion takes place and makes this particular, what part of this particular bone, and the sacral cavity which is like intervertebral cavity which is there, which is making the sacral foramina, sacrum canal, sacral hiatus, all these things, and sacral foraminas which is present ventral and dorsal, how they are present, you have to study that, because we will be starting with the sacrum bone. So whenever we are going for the next osteology class, we will be prepared with the sacrum, and then you have to study this particular lumbar bone as well. So it has got same features, like lumbar bones have got body and the projections, we call them as processes, spinous process, transverse process which is present on these particular regions, and again having same thing, lamina and the pedicel, which has got same articular points, we call them as superior articular facet, inferior articular facets. Addition to it, we have an additional feature of bone here, we call them as mammillary bodies, which is present in the facet or superior articular facets of the sacrum bones, of this lumbar vertebrae, and having what say lumbar canal which is present as the intervertebral canal, right. So you have to study the lumbar vertebra, 1, 2, 3, 4, 5, typical, atypical, you should be knowing them. What are the typical lumbar vertebra, atypical lumbar vertebra? If you cannot remember, that fine, only parts of the lumbar vertebra, muscular attachments, let go, don't have to, and the sacrum bone and features of the sacrum bone before Monday.